Throughout history, design in healthcare has seen our healing environments undergo major transformations into the complex and technologically advanced hospitals that we have today. Thoughtful design in healthcare can help facilitate the healing process of patients, prevent the spread of diseases, and allow healthcare professionals to adequately and quickly reach and treat patients. It can also provide a safe, supportive, and calming environment for patients. In early healthcare, hospitals were for the poor, and much of the healthcare that was administered was through religious institutions. These patient wards were unsanitary, and with a combination of controversial and experimental practices, became an unsafe and poor healing environment that cost many people their lives. By the 20th century, healthcare professionals had a better understanding of how diseases spread as modern medicine and science began to develop. The introduction of design standards and advancing technologies helped to create safer environments that meet patient needs. But what brought about these changes in design healthcare that have created the modern hospitals that we have today? We will discuss the key influences on healthcare design to better understand its evolution, progression, and history. We will discuss design movements in history, significant global events, and will examine key practitioners and other figures that have impacted in the evolution of healthcare design. Arguably one of the most prominent figures in the evolution of healthcare design in the last 200 years is Florence Nightingale. Nightingale was a nurse who revolutionized the practice during the 1800s. Her ideologies on the basic requirements of patient recovery are still prevalent in the design of healthcare centres today. Nightingale prioritised the needs of patients when considering healthcare design, highlighting the importance of ventilation, ambience, views, adequate natural lighting, and materials which were easy to clean, providing a safe and sanitary environment for patients and staff. Nightingale recognised a direct link between the physical setting and positive mental health that would ultimately aid in patient recovery. An example of this echoed in the autonomy of Clemson University in South Carolina, where patients are able to customize their lighting temperature to suit their needs. Nightingale highlights the importance of a connection to nature, both visually and physically. In modern-day hospital design, this is represented by east-facing windows for natural light and the inclusions of gardens and greenery. She also had a major impact on the ventilation of hospitals. Next, we have the tuberculosis epidemic. Tuberculosis reached epidemic proportions in Europe and North America during the 18th and 19th century. An overcrowding in European cities, rise of industrialization, and general uncleanliness provided the perfect environment for the endemic disease to spread. Tuberculosis specialists like Auguste Rollier argued that sunlight was thought to destroy tuberculosis particles as well as other vitamin deficiencies and diseases. To help treat tuberculosis, specialist buildings called sanatoriums were constructed. Here we see depicted the Zonnestraal in the Netherlands that was built in 1931, which translates to sunbeam. Zonnestraal paid direct homage to the regenerative and healing powers of the sun. These sanatoriums had balconies, natural light, and fresh air. The role of sunlight exposure for patients has still today been heralded for improving health and well-being and is a foundation of design principles in hospitals today. Sanatoriums utilize clean and impermeable surfaces such as glass and metal. These surfaces would aid in preventing the spread of diseases, making it easy to clean and disinfect surfaces. The tuberculosis epidemic resulted in a clearer understanding of disease and infection and was the motivating factor behind the architectural revolution that called for cleanliness, hygiene, and smooth surfaces. This machine-like aesthetic is still used in hospitals today and interior design as a human-centered approach brought about from the epidemic. Modernism was one of the key movements that came about in the 19th century. Modernism influenced a variety of industry and sectors as new ideas and big changes began developing through the rapid advancement of technology and science. In the design space, modernism urged simplicity, clarity of form, functionality, and the application of design with social purpose. Key modernist Alvar Aalto expressed functionality and social purpose in his work. Aalto took a humanistic impression to modernism through his sanatorium at Palmillo, which promoted the needs of patients and staff. It included key signatures of modernism, such as flat roofs, big windows, balconies, and terrace with sunbathing lounges. Aalto's design principles highlight the impact of modernism on the evolution of healthcare design, as we see rooftop terraces, open light, and outdoor spaces as key design elements in hospitals today. Aalto also considered the shape of objects like basins, faucets, doorknobs, and an armchair. He designed a deeper basin so that contaminated water did not splash and transmit disease. He also angled the faucets to reduce splash and noise, and designed doorknobs to ergonomically fit within the hand. The most prolific of the design is perhaps the Palmillo chair. It is still produced today by Artec. This chair was built from bent birchwood ply so it was easy to clean, and the backing of the chair angled to optimize breathing in a seated position. Here we see some of his key design. Modernism in design embodied the clean and new world that was craved for after World War I, with key modernist Le Corbusier stating, "Hygiene and moral health depend on the layout of cities. Without hygiene and moral health, the social cells become atrophied." Next, we have the introduction of chemotherapy. Chemotherapy has come a long way since it first developed in the 20th century, and the interior design relating to cancer treatment has evolved with it. The Peter MacCallum Centre in Victoria started as just one room in 1949. This pivotal moment shaped the oncology unit as we know it today, as it became apparent that previous settings and healthcare facilities were failing to meet patient needs. The interior design of oncology units or hospitals have a different layout to other hospital rooms. Chemotherapy rooms must be strategically placed close to the pharmacy for efficient administering and preparation of drugs. These rooms feature comfortable reclining chairs that make patient time in chemotherapy treatment as comfortable as possible, allowing them to sit up and spend their time watching television or reading. These open treatment spaces are key for interaction between patients, but must also provide privacy when needed. Because radiation rooms do not have access to natural light, it is also critical to make this room as comfortable as possible. Here we see a radiation room designed with a skylight for patients. The advancement in chemotherapy technology has led to changes in hospital layout and patient-focused design that promotes well-being and recovery. The AIDS epidemic started in 1981 and has established itself for more than 3 decades as a highly infectious international epidemic that has killed tens of millions of people. The disease has no cure, and patients require ongoing long-term care for the disease, putting constant pressure on healthcare systems and forcing a rethink in healthcare design. A study in 2008 found that the provision of confidential space was found to be the most important quality in healthcare design for AIDS and HIV sufferers, in promoting well-being, safety, and privacy. These confidential spaces are important for ongoing client care and support due to the stigmatisation of people living with the disease. Canada's only independent HIV hospital, Casey House, depicted here, responds to this need to provide confidentiality and support patient needs. The hospital removed shared inpatient rooms with private rooms that have outfacing windows and highly reflective glazing in order to allow patients to enjoy nature in private. The interior also includes private counselling space sessions and quiet outdoor spaces for contemplation, and has been heralded as life-affirming and life-giving. Healthcare facilities needed to become adaptable with their layouts and design to meet patient-specific needs. The AIDS epidemic has changed healthcare design in creating confidential spaces for patients and the need to promote patient well-being through thoughtful design. Healthcare design has changed dramatically over time due to the new technologies and advancement in society, and the need to accommodate these technologies in hospitals. The introduction of TVs in hospital rooms was a pivotal moment in healthcare as hospital stays can be daunting, especially when patients may be in pain or on the path to recovery. Clinical experts agree that a patient's hospital room plays a pivotal role in the healing process. Televisions have proven to be an excellent way to provide distractions for patients and keep them connected to the outside world. Television has altered the way hospital rooms are designed, with beds and chairs in waiting rooms now facing television screens, ultimately changing the landscape of healthcare design. Brought about from the early ideologies of modernism, there's been a movement and need to humanise hospital environments through design. The idea of humanistic design in hospitals encompasses the need for holistic models of healthcare, safe environments, and a distraction for the unwell, all considering humans at the forefront of design. Reducing the size of hospital spaces was vital in increasing humanistic design that promoted general well-being for patients and staff. A study found that the problem of overcrowded hospital beds needed to be limited to promote greater human well-being that would give patients more space and privacy to better recover. This humanistic design also highlighted the need to make hospitals more domestic and homely, rather than cold technological institution. The revolutionizing of hospital interiors, such as the Jacobs Medical Center in California, that created sculptural walls behind hospital beds to house medical equipment that was usually exposed, creating a more human environment for patients. Biophilic design was also essential in humanizing hospitals and focuses on humans' innate connection with natural patterns and environments. Today, we see outdoor spaces as well as patterns, colours, and materials of the environment to help connect users to nature within the hospital. Chalk Hill Child and Adolescent Mental Health Unit highlights the successful use of biophilic design as the woodland patterns blend into the interior space. This exposure creates well-being through psychological and emotional disposition. In modern-day healthcare design, Maggie Keswick-Jenks took a similar approach to healthcare design in her response to her own cancer diagnosis and hospital experience. As a result of her experience, she founded the Maggie Centres with her husband. After receiving her diagnosis, Maggie found the process dehumanizing and cold. This experience of the NHS corridors would spur her on to create a beautiful space in which to digest the worst of news. Maggie Centres create more personal space with their unique architecture. Every Maggie Centres aims to be an oasis, providing calm and reassurance and a quasi-domestic atmosphere in which natural light, physical comfort, and visual stimuli all play their part. Materiality is integral to the Maggie Centre as they have an element of tangibility with the raw nature of exposed wood and clever use of concrete. A welcoming environment is created with the choice of materiality, their tactile properties, and their careful placement within the building. The success of the Maggie Centres are demonstrated by the fact that there are 24 centres in the UK and abroad, with many more in the pipeline. These centres are inherently focused on the emotional response of its users and are responsible for the modern healthcare design considerations that we see today. The emergence of COVID-19 has to date affected 26 million people with over 800,000 deaths in 188 countries and poses a major global threat to population health centres. Despite being in the midst of this pandemic, we can still see the effects of these changes and speculate how healthcare design will respond in the future. A study in 2020 stated that spaces in waiting rooms, corridors, and hallways of at least 2,600 millimetres was needed to give enough room for equipment, while still maintaining social and safe distances for patients and staff. We've also seen a change in automative technology that will affect healthcare design, with automatic hand sanitizers, sensor temperature checks, and motion sensor sinks. These adaptive technologies and construction methods are required to eliminate transmission and will be much more prevalent in design considerations of the future. Commercial materials and finishes are also being reconsidered in interior design choices. Antibacterial surfaces and fabrics, such as natural materials, copper-infused or plated materials, fabrics treated with antibacterial agents, and even engineered stone are being employed to prevent infection. Although at a great cost, these epidemics have forced architects and designers to evolve and improve. The history of healthcare design has seen many positive changes as a result of negative human experiences. Healthcare design is still undergoing swift renovations. Human-centered design has become a central element in healthcare facilities, and understanding patient needs will continue to allow healthcare design to evolve in a positive manner. Thank you for listening to our presentation.